Hello again, and welcome at another episode of the SmartEducation Podcast. My name is Stan, I'm co-founder at SmartEducation, and today I'm here together with Michelle Lyons. She's flew in from Ireland yesterday, of course, to teach a course with us here at SmartEducation in Leuven, where we are right now, and it's a course about bowel health. Well, we'll dive into that a little bit later, but first of all, let me introduce Michelle to you, or maybe even better, Michelle, tell us, who are you? What brings you here?
Why am I here?
Yeah.
So first of all, thank you so much for having me here. It's been a pleasure. We've been collaborating and communicating for quite some time, and we've done a couple of power talks together, and
which were very successful.
Oh, thank you. It's
Thanks to you.
Well, joint effort.
Okay.
It's really a delight to be back teaching in person again to an amazing group of physios that you've gathered together about this topic. So I've been a physio for almost 30 years, and I've really been passionate, I think, about pelvic health. Like many pelvic health physios, I think, with my own obstetric adventures with the birth of my daughter, because up until then, I was very specialized in musculoskeletal and sports medicine. Mm. But then I had my daughter, and it was a challenging experience. And I thought there has to be a better way that we can help women recover after postnatal misadventures, I would say. Mm. So I really changed direction career-wise. And over the years, I've added to my toolbox. I've done Pilates teacher training, yoga teacher training. And most recently, I've just completed a postgrad in health coaching and nutrition. Because I really think when we're talking about pelvic health, women's health in general, we can't just zoom in on a particular body part. We have to really look at the whole person and what's going on for them. If we're going to be biopsychosocial practitioners, it's really the buzzword of our profession right now. We have to understand their story, where they're coming from, but all the different factors that can influence their health and well-being, and then how we can help them move out of pain and back towards living healthier lives.
Mm-hmm. You just used the word passion. I think you embody the word passion. If you talk about women's health, you start talking and you're so enthusiastic about it. We're so lucky to have you.
It's really a pleasure, and I feel that I shared the room today with a group of equally passionate physios, which was really, it was great to have those conversations and to get really an international perspective on what's happening in pelvic health. I'm really a nerd at heart. People ask me what I do for fun outside of work, but I really am very excited about what I do. And I think it's a really golden age to be working in pelvic health particular, but in women's health in general, because there's so much great research coming out to support what we have known clinically works for many years. But now we're actually starting to see a solid evidence base coming out as well. So we can point to this and strongly say this is an evidence-based approach to help women live well.
I do agree on the fact that there's a growing evidence in this domain of physiotherapy, but it's a skill to teach about it. And that's something that you
You're
do very well.
Yeah, Thank you.
You've been teaching as well for many years already with your own course organization that you're doing. And it's called Muliebrity.
Yes.
It's a difficult word. I practiced it a little bit and I'll try to do it again. Muliebrity.
Oh, well done.
Okay.
Well done. Much better than the first time you tried.
Don't mention that. No. But tell us and our listeners and our viewers, what is that word all about, and why is this so specific that you chose that word for your business?
So it's a word that I came across many years ago. Bill Bryson is an American writer, and he, like me, I've a passion about words, and I love reading and learning and writing. But this is an old English word that Bill Bryson described, and it means the art and state of being a woman. And I think that needs to be celebrated. I feel like for a long time, women's health, kind of like the difference between Coke and Diet Coke, kind of the same, but not maybe as good, And there was a book that I came across many years ago by Dr. Nika Goldberg, who was a cardiologist in the US. And the title of her book was Women Are Not Small Men. And I think for a long time, what we've done is we've really relegated women's health to what's sometimes referred to as bikini medicine, breast health and pelvic health. Mm-hmm. And we've looked at the research and we said, here's what works for men. We'll just do a little bit less of it and surely women are the same. But of course we're not. Mm-hmm. We've different anatomy, we've different physiology, we've different hormonal profiles. We have different life stressors that we deal with as well from a gynecological and obstetric perspective. So I really think that the art and state of being a woman should be celebrated. So that's why my company is celebratemulieberty.com.
Mm-hmm. Which I would advise to everybody to follow you on Instagram and Facebook. Yeah. But yeah, we were talking about bowel health today.
Yes.
Maybe we should talk about it as well now in this podcast. And this is going to be the topic that we're going to be discussing today and tomorrow, but also here in this podcast. First question I wanted to ask, and that came across the content here today as well. What do you think of our current lifestyle and the increased incidence of conditions such as constipation and irritable bowel syndrome?
Yeah, we've really seen a spike in the numbers of people dealing with irritable bowel syndrome. Particularly, I think we're somewhere around 1 in 10 people will be diagnosed with IBS at some stage in their life. But even issues with inflammatory bowel disease, we see that on the rise as well. It used to be almost unheard of, but in Western cultures particularly, as we've grown more affluent, we've grown more sedentary, and we're eating more processed foods. And we're exposed to different levels of stressors now. So now we see IBD in maybe 1 in 200 people, particularly in Europe, in the US, and in Australia. So I think we have to look beyond really, getting quite specific with anorectal anatomy and physiology when we're looking at lifestyle issues like IBS or like constipation particularly, and why we're seeing such an increase. Is it because we're not eating as well as we maybe could be? Excuse me. Is it because we're less active? Because we know physical activity has a huge role to play. Is it because we're all under a little bit more stress? Is it a combination of all of these things? And the answer is probably yes, it's a combination. But that's good because that means we have a lot of different avenues that we can address to improve bowel function. And as I said earlier, it's a great time to be working in women's health and pelvic health, but especially a great time to be working in bowel health because there's so much exciting research coming out about the links between gut health and bowel health and mental health, particularly depression, anxiety, even issues like schizophrenia and autism are now being linked to gut health. We need to get over the embarrassment that we have, that a lot of people have, about talking about bowel health. It can be quite a scary topic for a lot of people. People are scared of having bowel issues, far more so than, I would say, bladder issues, because people are worried about odors or leaking or staining. But there's so much that we can do from a physio perspective, particularly if we widen our lens to take a lifestyle medicine approach, looking at stress management, looking at what we're eating, but also when we're eating and how we're feeling when we're eating, how we're absorbing it, and then how we get rid of what no longer serves us. So there's many different layers to constipation particularly, which is my favorite thing to talk about. But we are definitely seeing an increase in lifestyle issues like IBS and IBD that for a long time we didn't think had lifestyle inputs. In the past, gastroenterologists would say, well, there's no point in talking about nutrition to somebody with IBD because it doesn't affect it. You can't influence it. Whereas now we're actually starting to see, again, just an avalanche of research coming out showing that not only does nutrition impact inflammatory bowel disease, but we also know that one of the strongest complaints that people with IBD have is fatigue. So teaching people how to manage their fatigue through exercise and physical activity done in a very graded way is not only going to help people specifically with their pelvic health issues, but also their general quality of life. So as physios, we've so much to offer. We're a low risk intervention. We're generally pretty low cost if you look at, comparisons with medications and surgeries. But I think this is an area that as pelvic health physios, we can really step into and shine and change people's lives.
Yeah. the reason why I asked the question is that I have a hunch that this is also the reason why the subtitle of the course is Bowel Function Back to the Basics. And the basics are then lifestyle, diet, stress.
Yeah, and sleep.
And sleep.
Sleep is the other big one when it comes to bowel health. And oftentimes sleep is relegated to an afterthought. Maybe we ask at the end of our session. But actually sleep is huge when it comes to bowel function, particularly in IBS. We know sleep is linked to pain, to persistent pain. It's linked to weight gain. It's linked to cardiovascular disease. And again, as physios, sometimes one of our many advantages is that we have the gift of time with the people that we're working with. So to be able to ask pretty intimate questions about bowel and bladder and sexual health, but also to be able to take somebody through some basic sleep hygiene strategies. Because sometimes I think we can forget that the things that are always obvious to us are not always obvious to the people that we're working with. But really having those four, sleep, food, movement, and stress management, as the cornerstone of living well, no matter what diagnosis we're working with, I think is really essential if we're going to, again, just take that step forward in lifestyle medicine.
Yeah. So you gave us a little bit of ideas on what we can do to keep our digestive system in optimal health. But let's maybe ask the question about the role of the pelvic floor within this optimal bowel health. Can you tell us a little bit more about that? Absolutely.
As I said today, there are generally 4 answers to any question I ask when I'm teaching. And the answers will either be broccoli, estrogen, the pelvic floor, or it depends. So the pelvic floor is often front and center when it comes to constipation, particularly, and IBS, because the 2 biggest drivers of constipation are going to be slow transit through the intestines. So too much water gets reabsorbed and we're left with really hard, dry, difficult to pass stools, or a lack of pelvic floor muscle coordination. So we're not relaxing and opening when we should, and we're not keeping things closed when we should. What's great about the pelvic floor muscles are, if we address the pelvic floor lack of coordination, we have a lovely case study, I think from back in 2013, from Binford et al., that showed that by improving pelvic floor coordination, we not only improve the outlet dysfunction, but we can actually improve transit times. So the pelvic floor is literally the answer to everything, but then we build on that to start introducing healthier habits like physical activity, which is shown to improve constipation measures. Stress management is huge as well, because we talked about that in the class today, how we each respond to stress. Some people, when they're stressed, they end up with diarrhea. Some people, when they're stressed, they end up with constipation. But that link between the gut and the brain and that conversation that the 2 of them have with each other, again, it's fundamental to all the different health parameters that we're interested in.
That's also an area where we see a lot more evidence, research coming.
Yeah.
It's a very interesting domain. What got stuck in my mind this morning is that you were talking about, maybe if you want, you can share this. You were talking about Hercules sphincter.
Yes. So
it was like a visual idea from.
It stuck with you.
Yeah.
So we were talking basically about one of the key things that we can do if somebody is suffering with either constipation or anal incontinence. One of our key steps is going to be to build a better stool. We're looking for that nice type 4 and a Bristol stool scale, smooth and soft like a sausage or a snake, a very poetic description. Because if you're prone to diarrhea, to a very liquid stool, even the sphincter of Hercules would not be able to keep that flow back. I believe is something along the lines of what we talked about. Your rectum is not designed to control liquid stool. No. So if someone's having leakage issues, one of the first ways that we're going to address this, yes, we're going to look at what's happening with the external anal sphincter and pelvic floor muscle coordination, but we need to build a better stool and really step away from a disastrous liquid stool.
That's why it stuck to my mind, because it's because we're talking about bowel health and the role of pelvic floor. Yeah. But maybe sometimes it's not the main issue. You should look at what we're eating, what kind of stool we're making. So that's has to be an important part of management of these kind of...
Most definitely. We have to, it's not just about, as I said, just zoning in on the pelvic floor and seeing what's happening there. We have to look up the chain to what's happening at the other end of the digestive tract, so we talked today about the journey from mouth to anus. But a big part of what we talked about today was the gut-brain axis as well, and how that information superhighway between the vagus nerve, communicating with the gut and with the brain, and our stress response and our resilience to stress as well. We talked about how one of the most important questions that you can ask somebody when we're talking about persistent pain is, what do you do for fun? What brings you joy in your life? And to really be able to tap into what's meaningful for them. Because there's no point in someone like me saying, you should do this, you should do this, you should do this, if that's not going to get your attention, your motivation. We really need to help people help themselves. So finding out what matters, what they're willing to do to make small gains, and then we can help build on that progress. But it's absolutely taking a whole person view into account, what's going on in their body, but also what's going on in their brains.
Yeah, thank you. Well, there was something else I wanted to ask you. We were here today with a group of pelvic health practitioners, which of course are familiar with problems with bowel health. But on the other hand, I'm sure a lot of MSK physiotherapists, for example, like you said, there's a kind of a taboo, or maybe MSK physiotherapists don't dare to ask about pelvic floor bowel health.
Yeah.
I think there's a lot of work to do there.
Oh, for sure.
And can you maybe, how do you try to get the message across to those group of physiotherapists? And I'm hoping that a lot of our listeners here are not only pelvic health practitioners, but also MSK. Yep. What message would you give to them? Why it's so important to leave those taboo ideas behind them and go and ask about...
Go bravely forward. Ask the questions. I think, first of all, if as a physio you're embarrassed asking about questions, your patients are going to pick up on that. So we really just need to normalize the pelvis as a part of the body that we ask about its function, in the same way that we would look at the knee or the hip. But I remember before I entered the murky world of pelvic health, I remember as somebody working in MSK, you'd screen somebody who'd maybe had a trauma or an accident, and you'd ask them, so any problems with your bowel or your bladder? And inside your head, you'd be like, please say no, please say no, please say no, so we don't have to talk about this ever again, And of course, now it's all I want to talk about. But if we're looking at something like back pain, so we have great research showing that, for example, Smith's paper from 2014, that for women and back pain, there's more of a connection between constipation, bladder control, and our breathing strategies and back pain in women than there is between physical activity and obesity. So those are stronger links between back pain and women. So we have to ask those questions. And if we look even, more recently, Dufour's paper from 2018, she and her group, again, looking at back pain in women, but over 95% of women with back pain had pelvic floor muscle dysfunction. And it's almost always overactivity of the pelvic floor muscles in both those cases. So the pelvic floor muscles are a very emotionally responsive part of our bodies. It's where we carry a lot of our tension and our stress. But of course, that's going to interfere with our ability to move confidently through the world. If we're stressed, if we're holding everything together, we used to talk about core stability as being, a central tenet. And it's more core resilience at this point. Do we have a happy, healthy pelvic floor and diaphragm? Because you can't really talk about one without the other. And are they moving and working together functionally? And I think if, as an MSK physio, you're okay asking about bowel health, are you having any pain? How often are you having a bowel movement? Knowing what's normal. The Rome criteria say that anything from 3 bowel movements a day to 3 bowel movements a week, those are the parameters of normal. But knowing if someone is constipated, that's going to be a driver for their back pain. But it's also going to be a driver for their stress and anxiety and maybe their insomnia, which we also know is going to drive up their back pain as well. So it all starts to fit together into this jigsaw, this puzzle. And you can't just take one aspect, looking at doing a unilateral mobilization of L4 and L5. It's really being able to take a step back and looking at the whole person, bringing bowel health really front and center, bringing pelvic health in general, I would say, certainly in the realm of low back pain.
Yeah. So actually what you're saying is, if you want to deliver good management to women, but also men with, of course, low back pain, you should ask those questions.
You have to.
And if necessary, refer them to a pelvic health practitioner.
Absolutely.
The good thing is that we see much more multidisciplinary practices. I don't know how it is in Ireland, but here it's almost a lot of physios now work together, maybe not always in the same building or a real multidisciplinary practice, but at least they have a network. That's how I work, and I think everybody should work and work together, like you say.
Yes.
Somebody knows a lot more about that part of the jigsaw than somebody else, and communicate with each other. Yeah.
But isn't that like, I know it's quite popular to bash social media, like Facebook and different platforms. But I think that's one of the joys of having groups of physios from all over the world being able to get together and have conversations. And I'm having this issue with a patient, keeping anonymity. And somebody says, well, have you asked about this? Have you asked if they're having any bladder incontinence? Are they having any constipation? How are they sleeping? Oh, I never thought of that.
Yeah. So you need to
collaborate,
shout out in the community and embrace those technologies.
Get the support, absolutely, because, everybody's got
or
different levels.
With you.
Well, that would be another way to go as well, of course. But we're all, a rising tide lifts all boats. Yeah. And I think as a profession, we're generally pretty good at supporting each other. But I think that's really been something that I've enjoyed seeing over the past couple of years, the use of social media to improve patient care and collaboration.
Yeah, that's something we need to cheer.
Yes, for sure.
Of course. Something that we didn't refer to, well, you talked about the difference between men and women, of course. The questions we need to ask also about menstrual health.
Yes.
And the relation of that to pelvic floor dysfunction, to bowel health.
Absolutely.
Can you give us a little bit? Because that's something, of course, that is going to be covered in maybe some other courses we'll do in the future.
Absolutely. Hopefully in the spring we'll be back to talk about female pelvic pain. So it's another area that I'm passionate about, but I think teaching women to track their menstrual cycles and any symptoms that they're having so you can see any patterns emerging. So, for example, with endometriosis, which is one of the most common pelvic pain conditions affecting women, 1 in 10 women worldwide, it's estimated, will have endometriosis. But despite its being so prevalent, we still know that there's often a delay. The average delay for diagnosis for endo is 8 to 10 years before women get an accurate diagnosis.
That's a long time.
It's too long. It's really too long because a couple of different things. One, it's almost become accepted that periods should be very painful, which of course they shouldn't. But second of all, a lot of the symptoms of endometriosis can mimic irritable bowel syndrome. So often women are misdiagnosed as having IBS when they actually have endometriosis. But if women are educated and empowered to actually say, no, it happens at this point in my cycle, every month, it gets really bad, and looking for patterns that emerge, I think is one of the greatest things that we can give to empower the people that we're working with. So it was one of the things that we were talking about today, to really change our perceptions of ourselves as mechanics coming in to fix people, but actually more as educators, giving them the tools to help themselves. So many gynae and pelvic pain conditions will also have bowel symptoms. So is the menstrual or hormonal dysfunction, I should say, is that the driver of the problem, or is it just also happening at the same time? And that's where kind of really getting quite specific with tracking menstrual cycles or menopausal status and looking for any patterns that emerge can really help us advocate for our patients and again, then help them to advocate for themselves. Because what we know about endometriosis is that by improving bowel health, and encouraging an anti-inflammatory lifestyle, you're definitely going to turn the volume down on the pain and disability. But for women with endo, the gold standard is still going to be laparoscopic excision, followed by pelvic rehab. So we're an important part of the picture. We're not the entire picture, but we're a key part often in sometimes identifying the problem, but also then in being part of both the prehab and the rehab, maybe after any necessary surgeries, and maybe hoping that we help women avoid unnecessary hysterectomies, which are often performed as well. So I think for a long time with women and pelvic pain, there's been this almost trend of we don't know what's wrong, so we're just going to take the organs out and hopefully that will solve it. But of course, that comes with its own problems as well, with bone health and brain health and heart health. So what we really need to do is get back to basics, understand what's happening with the menstrual cycle through the reproductive years into menopause, because that's not something that's factored in, obviously, into male pelvic pain. Because men have a slightly less complicated hormonal cycle. They've got a 24-hour cycle. Whereas women are going to have this 28 to 30-day cycle for about 40 years of their lives. And estrogen has about 400 different functions in the female body. And a lot of it is going to be in the region of pelvic health in terms of affecting bowel function, bladder, sexual health, but also brain and heart and bone health. So yes, again, we can zoom in at the bowel issues, at the pelvic pain issues, but also being able to zoom out and see the whole person and how their menstrual function is affecting their life, whatever life stage they're at.
I think that's an important message you're giving there. Yeah. And it's clear that there's much more to learn. So I look forward not only to today, but also when we have you again in April with us.
Lovely.
It was an honor to be able to have this chat here with you. I hope our listeners and our viewers got something out of it. Maybe got a little bit of inspiration. You know what I got from Michelle? And I will show this in the camera, but I will not be able to explain it in words. This morning, I got something like this. What you're seeing is socks with a smiling poo on it. So that's a great gift.
You're very welcome.
And that's also a way of getting the message across.
Absolutely. That we want our bowel movements to be happy and healthy and pain-free.
Yeah, that's the ideal. Yeah. Thank you for your time here,
My
Michelle.
pleasure.
I think it's time to grab something to eat together.
Sounds good.
And we'll see you tomorrow. If any of you was being inspired, like I said, by this talk, please check our website and have a look at what other courses we're going to be organizing together with Michelle, but also on all other topics that concern not only pelvic health, but also MSK. Have a listen to maybe some of our other podcast episodes, because every time we have the opportunity to have an interview with an international guest, we do grab that interview, and we hope you get something out of it every time again. Give us a like, a shout out on social media. That would be great. That was it for today. Hope you're enjoying the rest of your day, and see you soon. Bye. Thank you. Thank you, Michelle.
Pleasure.